Kimberley region, located in the north of Western Australia, covers an area of about 423,000 square kilometres. It has a population of nearly 39,000 people, with approximately half the population identifying as Aboriginal or Torres Strait Islander. There are around 200 Indigenous communities in the Kimberley, and traditional culture is a strong part of everyday life in the region. Broome is the regional hospital for the Kimberley, with smaller sites located in Fitzroy Crossing, Derby, Halls Creek, Kununurra and Wyndham.
It is a job for generalists. It certainly helps if you've got a cultural understanding and an understanding of Indigenous health and the difficulties in remote medicine. The ideal doctor up here would be a rural generalist, at least someone who's got some broad range of skills and certainly some emergency skills, because you are expected to be able to look after emergency situations.
You're working in a job which is continuously pushing you. No matter how much training you do, there's always another thing around the corner, another sicker patient who may not have survived 5 years ago, but now is, and so there's always those little highs. And the team you work with are amazing. You get close and they're good friends, they help you out, you help them out.
I feel incredibly lucky to work in the Kimberley. I feel incredibly lucky to work in a predominantly Indigenous community. I feel like I've learnt endless amounts of valuable things about our country.
The reason that I love this job is because of the variety. So I could be in a remote clinic doing GP work, I could be doing a diabetes focused clinic, I could be flying to Halls Creek to do an antenatal clinic for the women down there as an outreach program. I could be delivering a baby. I mean, I can't even list, that's the extras, and then our kind of core day-to-day work most commonly would be in emergency or working on the ward looking after inpatients. There really is no such thing as a typical day. Working in a rural environment, I feel, has really added to the breadth and depth of my skills. There isn't a specialist around the corner. They're often on the end of the phone and they give great advice, but we get to do a lot more things here than you would in other places.
I think that we're a pretty friendly bunch and we try and be pretty helpful, and the medicine is good. So there's lots of really interesting sick patients, lots of complicated stuff, lots of learning opportunities. We get to see a lot of kidney disease, a lot of Aboriginal health, complications of crazy uncontrolled diabetes, a lot of infections and sepsis.
One of the anaesthetic and ED district medical officers in Broome, also the director of clinical training here. I also do part-time RFTS with the helicopter retrievals, and so it's a nice varied job. I really enjoy the emergency department. I really enjoy the emergency department team I work with and the job I do there. It's varied. I can have days where you're doing a lot of subacute care and then suddenly a much bigger case comes in, and I do really enjoy that. I enjoy working with the JMOs, the junior docs, and I really enjoy teaching. So you do get to you get experience a lot more and have a bit more responsibility.
People rarely come with one condition. You need to think about heart disease, respiratory disease, mental health, social stuff, renal disease, infection. You need to pay attention to the full picture, and that's a good thing to be asked to do.
There are certain situations where we have to anticipate where the situation is going clinically and mobilise quite early. You do need to be able to handle that with a small team. And so there are some particular challenges involved in that. That's not every day, but you need doctors that have the capacity to handle emergency situations, as well as run general practice, as well as run a ward and be familiar with chronic diseases. There's a lot of chronic diseases, a lot of dialysis patients, there's ischemic heart disease at a young age, chronic respiratory illnesses.
My passion has always been working in Aboriginal health. That's what brought me over to WA and eventually came up here to Derby to do my GP training. It's definitely been an amazing career. I feel quite lucky to have such a varied job. I can honestly say that it's never boring. Like, always come home at the end of the day feeling like, it's been rewarding and a satisfying career for sure.
So one of the most rewarding aspects of my role is being able to live in the community that I work in and build relationships with people. I think people are more likely to engage with you and talk with you if they know that you're committed to making the town and their health and things like that better. It's just so nice feeling like you're part of a greater service provision, that I actually have some say in how we provide patient-centred care and making positive change towards the ultimate goal, which is, closing the gap and having that community engagement. I just think it's wonderful being able to do that at a grassroots level.
It's a really good town. It's really good people. It's not very many places where I can have this sort of contact with First Nations people, and people are very generous with sharing their story and the history of our country, which we all need to learn. And the other thing is, this town, the non-Indigenous community in this town is full of amazing people. From amazing people with extraordinary stories who love the town.
The people, particularly the local people, are funny and beautiful people, and you'll see some beautiful interactions between the staff, between nursing staff and patients that they know long term, and that they know their family, and that doesn't happen in metropolitan Perth. And so it's that special experience that draws people back, actually.
I like feeling that connection to people, not just in a consult room. I was showing a new doctor around Derby the other day, and he was so shocked, I guess, to see that nearly every single person that we passed would say, "Hi, Dr. Prue," or "Hi, Prue." It's always on a first name basis, which I really like.
We like to go camping. We go out to El Questro or other places along the Gib, or down to Penalulu or Keep River National Park. Some of the local spots that maybe you don't know about yet, but you find out when you've been here for a little while and you get to know the right people and someone draws your mud map.
We have a lot of time here, more time here than I'd have doing any other job anywhere else. I don't have to travel to work, live just around the corner. And motorbike riding, horse riding, on a boat, and camping, it's pretty hard to beat the hobbies.
Give it a go, because you might find something that really fits you and what you actually want to do for the rest of your life.
Definitely something magical about this place. I guess it's the raw natural beauty, but for me personally, I think the community, the really strong sense of community, that seems to keep people here and bring them back.
I'm completely converted to the Kimberley.